In this episode of Lab Matters with me, Harriet Gould, machine learning expert Marcel Gehrung covers culture comparisons, the transition from academia to industry, company structure, and more. Today, we are joined on the Lab Matters podcast by Marcel Gehrung. Hopefully, I've said that correctly without too much fuss. Now, Marcel holds a PhD in machine learning in healthcare. He was named on the Forbes 30 under 30 list and is an advisor for Innovation UK and the Science Seed Fund. And Marcel is the CEO and co-founder of a company called Cited Healthcare, which is a Cambridge-based medtech firm that focuses on providing pre-cancer diagnostic capsule sponge device called Endosign. We'll come on to that and how that came about. Now, Marcel, you've been in the UK for, well, less than a decade. You started out in Germany and have done reams and reams of education. But I want to hear a little bit about how you came to focus on science and what it was like going through the motions, as it were.
No. Hi, Harriet. Thanks for having me today. As you said, having been in the UK now for almost 8 years or so, there's almost been this natural inflection point, in a lot of the time where I spent my education, which was obviously in Germany, and then obviously coming to the UK, where at first I thought, I'm going to be more committed to probably the academic trajectory and the academic pathway, but then obviously ended up starting the company that it's been running for 5 years now. But maybe to take 2.5 steps back and start at the beginning. When I grew up, I was always someone who's very interested in science, very broadly and very specifically, always interested in healthcare. Had some sort of personal health backstory that was actually congenital heart defect, and had big open heart surgery about this when I was 14, 15, which took me out of school for a year. And that year is actually pretty important because I did spend my time in that year doing a lot of video gaming because I was a 15-year-old, but also at the same time, I taught myself programming. Now, you could have asked, didn't you have any better things to do? Yes, probably the video gaming, but that's, of like having 1 year out of school, that's the opportunity that gives you. But that year became pretty important because at the end of that year, I started doing some web development and homepages, but also other small software development projects for friends and family, sort of giving the first spark of entrepreneurship that I encountered in my life. I obviously still, was in school at the time, finished school, but by the time I had that, I got it over the line. Those projects that I started, around the age of 15 with first friends and family became a bit more mature and professional. The teams that I had been working with me on these projects became bigger and bigger. So instead of going to university straight after school, I actually started a small software consulting firm, and did that full time for a year. And then we had it to a point where there was a level of ongoing business in there that I then still decided to go to university at the same time. And essentially, while doing my bachelor's and master's, kept that sort of like both running in parallel. It obviously, in terms of growth, was pretty limited because it was, a side activity while studying, which was obviously the primary focus. And come 2016, 2017, when I finished my master's, I actually come to Cambridge here in the UK and did a sort of like 6 months placement. And at first thought I'm going to come back again and then probably do a PhD somewhere in Germany. Then got infected by, let's say, the Cambridge virus and met another professor who ended up becoming my PhD supervisor, and made an important decision at that. That was Florian Markowitz out of Cambridge. Interestingly, I always had these small jumps in topics because I started in material science in my bachelor's. I worked in biomedical engineering in my master's, and then I got into medical imaging and into some other machine learning applications in healthcare. But the most important inflection was actually when I left Germany. I came then obviously to the UK to do my PhD, stopped the software consulting firm, business, and I told myself I'm going to be fully dedicated to the academic journey and experience for the next few years. Now, that came with a promise that I'm not going to touch anything entrepreneurial for the time being, which means, starting in late 2017, 2018, I tried keeping that promise. Unfortunately, what happened is that the idea for the company that we ended up building was already had 3 months into my PhD, so wasn't very good at keeping that promise to myself. But it created an interesting PhD experience because I had the privilege of being able to work on some very focused questions, which also enabled us to run at pace with answering these questions. But then also build the foundation of what ended up becoming the company. So I had this transition, which I think was very important, where coming to the UK sort of like gave me almost like a soft reset of any of the things I'd been involved in before, but it also then gave me the perspective of a lot of the network that came with doing my PhD here around stimulating the entrepreneurial persona inside me, and obviously pushing ahead full steam, just a few months after coming here. And originally, as I said, not wanting to do anything entrepreneurial for the time being. But yeah, that's sort of a bit about the backstory.
Mm. And when you were at school, were you encouraged towards science? Did your parents think that there was scope there? Did your teachers see it?
I had one very influential, and he's probably the reason that I ended up in biomedicine. I had a very influential biology teacher in sort of the last 2 years of school. Before then, probably yes is the answer. I mean, I was always interested in science, but I think there was also, because me having had to take that year out of school because of health, there was a challenge there on, I missed a year essentially, and that's not particularly helpful, particularly at that level of school in Germany, where you just have finished scratching the surface in a lot of subjects, and now you go one level deeper. So I had a bit of lack of continuity there. So it took that one teacher actually in the last 2 years of school to really spark that again. But I think after that, it became very obvious for me that I want to end up in some biology related field, one way or the other.
Mm. And do you think, other than from that teacher, the actual experience of having something so seriously wrong with you, do you think that had any impact, or was that just coincidental?
No, it did. I mean, it's not the greatest age to be, sort of exposed to a level of existential angst that I hope that most people will never have to have in their life. So it makes you, or it made me ask certain questions that probably, at the age of 15, you might be just about in a position in your life that you can articulate the question, but you're so far away from knowing what flavors of answers these questions can actually have. So I sometimes say these days, if I wouldn't have gone down the non-clinical medicine, if I would have gone down the clinical medicine track, opposed to what I've obviously now done, not studying medicine, I probably would have ended up as a cardiovascular surgeon, because I still have a very, very strong attraction to that field in general, and every time I come across a company that works in that space, it's deeply intriguing to me. But yeah, it certainly, I mean, to your question, it certainly has left a massive fingerprint somewhere in my life, and also my core beliefs and core interests. So it always catches up with me one way or the other.
I can imagine. And then, so you said you automatically or immediately recognize the benefits of being in Cambridge, surrounded by the entrepreneurial spirit. Is that very different from how things are in Germany?
I think yes, mostly because I think there's probably a few different layers there. One of them is cultural, and I think if you look at academic culture in Germany, yes, probably these days you will find particularly younger professors that have some level of entrepreneurial inclination, and either within their research groups or by themselves independently are either consulting for big corporate firms, or are thinking about starting their own company based on some intellectual property that comes out of their research. But I feel like, I mean, Germany has this, and if there are any German listeners, they probably would smile on this one. But in Germany, there's this classic, we've always done it like this type of attitude in a certain generation, and then I think most people would certainly not contradict that. It's one of the backbones, but then also one of the challenges that Germany probably still has today. And in the academic culture, if you think and take half a step back on that, is if you are not willing to take risk, if you're not willing to embrace some level of change and uncertainty, then you never create the opportunities within an ecosystem that also enable PhD students, postdocs, or even bachelor students or master students to even think about taking that type of risk. Because you look at those, you look at the authorities around you to sort of like give you a calibration on what level of risk is acceptable at which point in time. And when I came here, it's different, because there's a lot of people that are very deeply motivated within their fields, and they do not see this artificial boundary between there's an academic idealism and we all subscribe to that. It's a lot more fluid. There's people engage with companies. There's a lot more thought about technology transfer and what intellectual property can actually be leveraged for to make impact in the real world. And it's always something that I didn't know I was missing until I saw it right in front of me. I had this other impression that obviously is a very prestigious university here. I sometimes joked about this in 2018, 2019, and at the end of the day, when it comes to how science is conducted and how research is conducted, everyone is cooking with water. And what that means is, there's no magic ingredient here that makes things a lot better than in many other universities or ecosystems in the world. But there's something about the people here, and something about how these people want to have impact, and what they want to do, what they are doing, and what they want to do with it, and where they see the limits of that, and the ability to also try to break through these limits when the opportunity arises.
So it's a well-earned reputation then in Cambridge.
Yeah, I think so. Yeah, I mean, it also has its like any ecosystem or like any environment, it also comes with its challenges. But I think if you constrain it to your question there, for someone like me, I was probably born as a very particular type of entrepreneurial thinker. I wouldn't call myself as particularly risk seeking in life in general, but there are certain things where there are certain things where that doesn't seem to apply. But I also realized that the right environment is able to tease it out of me much better than me being able to do that myself. And that's certainly what coming here has done for me. And I mentioned it earlier, leaving a country and taking on all of that change, it also gives you a bit of an opportunity to particularly I was in my mid-20s at that point. It gives you a bit of another opportunity to also figure out who you are, who you want to be, and all of this sort of coincided for me roughly about the same time.
So did you say 3 months in? It was 3 that you had this idea of the
yes yeah.
And you obviously shared that with people around you, and
it was one of these interesting situations that and I think that's probably still the case today, if you work in a computational or well, even particularly machine learning or statistical learning field, if you come to a place like Cambridge, there's a lot of clinicians and a lot of other researchers out there that sit on large amounts of data, and they have many questions, but they don't have the tools to be able to interrogate the data or answer these questions. So to some extent, depending on how you're able to build your network, probably early in your time here in Cambridge, there's a bit of you can almost evolve this to a bit of a kid in the candy store type of environment, because you have so many people with so many interesting data sets and so many interesting questions. So I and Florian, my PhD supervisor, basically brought me exactly into that situation with his network, and he introduced me to several different people, and they all had lots of interesting data. No one that really could help them interrogate this data. And I ended up working specifically with one person, Rebecca Fitzgerald, who's professor for cancer prevention here in Cambridge. And she, when I had the very first conversation with her, like it didn't take us a long time to find a lot of common ground in what are the questions that really are worthwhile looking into, and how we can take it from there. And out of those conversations with her, I think, several months in, I asked the innocent question of like, why has no one started the company in this space yet? And one question led to another question, and obviously then, led to us actually starting the company.
Did you find it easy to start the company? In a technical sense, I mean, in a functional business startup sense.
Yes and no. I think in the moment, I think easy is relative, but the wonderful thing is, you don't know what you don't know at that point about the complexity, and obviously that, with particularly if it's a growing business, then there's other levels of complexity that are going to add themselves into the equation. I think I had this great benefit of being on the springboard of doing having the springboard of my PhD that was basically happening, alongside. And actually in 2020, I had a year where we started building the company after we raised the first round of money or funding, while also finishing my PhD. So I had these two tracks that were sort of like, blurring into one another, but it also didn't make it an abrupt change. So I wasn't really exposed to it overnight, and everything had changed in my life, and I was exposed to all of this uncertainty all at once. I had almost a period of a year where I was phasing out of one and phasing into the other. So I was able to pick up a lot of the things and a lot of the basics, while not having to actively think about it, just because I was in this state of flux and in this sort of like transitional time.
Interesting. And at what stage would you have said, yeah, this is really actually going now. This is functional. This is going to be something.
It probably was I can give you the answer which people would expect someone to give, and then the honest one. I think any entrepreneur that starts a company, and particularly in science or in deep tech, there is a level of, I think it's sort of like, if you're the founder CEO with a scientific background, or you have a certain approach to scientific thinking, then you'll always have a level of doubt about, how well it works and how well it can work, because I think that's an important driver for not giving up on us answering all the important and meaningful questions that arise. So I think it's, there's probably a level of diminishing returns in belief you get, but I think it's also the doubt, which obviously in the beginning is very high, because you don't know, what the shape of what you're building is going to look like eventually. And versus over time, you might know that more, but then you also know all of the things that still need to be proven out. I think if we, I'm a person that tries to sometimes put numbers behind these things, but in the beginning, you end up having an idea, and someone is willing to take a risk that is very much based on the people that are involved. Now, after two big funding rounds for us, and another one that should be, or is coming together actually as we speak right now, you're in a position where we're now raising capital from investors that are backing what we've built, and the level of risk that we've already been able to reduce in what we've built. And I said this actually to the team the other day. We had our team kickoff for 2025. That it's actually really reassuring, because over the last year, the plans of the company have not fundamentally changed anymore. Whereas in the beginning, it's constantly evolving. You're more reactive than you're proactive. And I think only over the last year there is a level of good baseline confidence that has evolved on what we're doing is the right thing, and we are reasonably confident in that. In the beginning, you'd probably hear me say the same thing, but without some of the confidence of being able to go back a year and say it hasn't really changed that much. 4 years ago, I would have told you, yeah, we're on the right track. We don't know exactly what the right track's going to be, but it feels like we're in the right place. And I think now we have some data points on being able to say we probably know that we're in the right place and we know that we've done the right thing. So it's this, certainty increases over time, uncertainty decreases over time, but uncertainty always comes with very nice fluctuations over time too. So even though if the trend is downwards, it doesn't mean that there's a time, even these days, where it flips up again and then it comes down again.
Important point to make that.
Yeah.
Now you've got one of the UK's only what's referred to as a vertically integrated laboratory. It would actually be nice to hear a little bit about that, from how the innovation and efficiencies have been built into your laboratory, or how you've built them in.
Yeah, so we actually came into this situation through very interesting journey, because when we started, and maybe just for context, obviously the company is based on two pillars. One of them is our minimally invasive cell collection technology, and the other one is laboratory biomarkers of those cells that have been collected from the esophagus, and then those cells being tested for either precancer or any signs of progression towards cancer, and also other diseases. But when we started, we obviously had, the technologies in hand, but we didn't have the architecture on being able to say, let's say, Harriet, you're a patient that gets our test. We know how to administer the test to you, i.e., we have someone trained that can do the procedure, and then it goes back to a laboratory. The laboratory runs the test, and the result comes back to the clinician that is looking after you. We started from scratch on that one, and one of the big questions for us was are we building our own laboratory from scratch? Are we partnering with someone? We ended up actually making an acquisition during COVID times on that front, but it fast-tracked us to a foundation and platform where we had a laboratory where we could run our test, and we had an end-to-end clinical diagnostic laboratory and a pathway in place. But then we were in that situation that because we started, because we're not only we're not a service provider, that develops or that delivers a commoditized test. So we're not like doing blood, a complete blood count, or we're not doing other types of commoditized testing. Obviously, what we do is pretty bespoke and pretty new. So the more ownership and the more control you have over that, particularly in the beginning, the better. And that particularly relates to data that comes out of those tests, how that relates to the follow-up of patients, et cetera, et cetera. So we started very quickly in the early days on not thinking about the laboratory component as an entity where the sample comes in and there's something else that comes out, and then there's a result that comes out and goes back to the clinician. We very early on developed a very, very several layers of very low level business intelligence around managing operational metrics. So things like turnaround time and all of that, which are obvious, but then also other interesting metrics you can derive from that, which just enable you on the one hand side to become better at operating as a company and operating within a lab infrastructure. But then the other stuff is the really insightful bits, which is we took a very sort of like user discovery and product centric approach, and also how we have improved the tools that are being used in the laboratory, like software we have been building that is sort of middleware that is used, for example, when we digitize pathology slides, how that then ties into our internal reporting systems. And I do feel like, and when we started early on, when we talked about the term vertical integration, it sounds like it's this like huge ambitious piece that is sort of like this monolith, and it's all sort of like baked in out of one, or baked into one piece. I think we've learned over time that it's a lot of small quality of life improvements and connections between different systems, whether that might be hardware, software, but also how the team, for example, in the laboratory is generally integrated into the rest of the organization. So one of them is hard and the other one are soft components on how these things come together. We ended up calling it vertically integrated at some point, but it has become probably vertically and horizontally integrated at the same time, if that makes sense, if you see where I'm coming from. So there's a technology layer, but then there's also just like the cultural layer of a lab simply not being a black box, and making sure that's integrated within what else the company is doing.
And I mean, theoretically, you could use that model in any company to prevent silos and
Correct. Yeah.
yeah.
Yeah. In any manufacturing business, you can use the same thing. And then, it's one of the reasons why, there's there are certain types of inefficiencies that can creep in really well if you're not able to see the whole thing all at the same time. And if you look at the various different things in isolation, and I don't mean necessarily, that they work in silos. I think it's also a leadership culture element on do all elements weigh the same, even though that at different points in time they might have different levels of impact. Like, do you put a relatively similar level of emphasis on all of them? So obviously you need to always go after the biggest problems, one after the other. But I think keeping the right visibility and how you triage through these problems, it stops you from missing something that is just because it's hidden away in a pocket. That, let's say that could be a lab, that could be a manufacturing facility, or that could be a production facility. Everywhere where you have like a complex operational and logistical sort of like process going on. Yeah, it's also, I think it's really how a company wants to view it, and not necessarily just how people have done it all along.
Do you think people can sense that when they visit? Do you think it's visible, or they can feel it?
I'm pretty confident, yes. And it it always has been a, since I mean, when we had this from the very early days. In our case, it's the lab is not actually in Cambridge. It's a bit outside of Cambridge. So we have these two sites, making sure that people are traveling and commuting and work from both places from time to time is also really important, because at the end of the day, the vibe you get and how you experience the people when you go into either of our two sites in the UK, that's really shaped by how closely these teams are culturally aligned. And the only way how you can do that is by making that overlap that as much as possible, and not separating it out. Now some businesses obviously might have these types of functions all in the same place, that can also work really well, and sometimes probably is better than having it in two separate geographic locations. But I do think that people can tell that. Like, if you and I were to walk in there, you would feel the same cultural warmth and sort of integration. Then I think that you would feel like if you go to the Cambridge office and you meet a team there. But that's also, I think, because we have this practice, which if some people from our HR and people team are listening, we had and we still do it today. Before we hire someone, I always, even if we technically have made the decision to hire that individual already, I always have a 20-30 minute conversation with them at any level that we're hiring. Mostly because my main criteria is seeing, are they good people? Do they care? And do they care about the right things that aligns with what the rest of the business and the individuals care? And we have said no before based on this, but it's one of the things that I personally, now at the size of organization we are, see as a key role, which is you have so many different moving parts, but one of the things you can try to control is the types of people, what their core values are, and making sure that there is some kind of common ground, that you're not going to get people that get really nasty with one another. And I can very happily say that from a sort of like, I think, cultural health perspective and sort of people health perspective, we've always been in a very good place, mostly because if you do this a few times, you then obviously build a team that really cares about those same type of core values. So it starts propagating by itself. And it's probably one of the only things that, has not really changed in terms of how I am involved in running the company, which is I still have this last conversation with every single person we hired, just to get a bit of a temperature check on, is this going to work, or are we going to create something that is difficult? We also made some mistakes in the past on that front, and then obviously we rectified them. But so far we've been pretty good on keeping that tight. So
sounds like a good safety net.
it's a good safety net. having sensible people and good people is the best safety net that probably I think I underestimated that before. Whatever happens, if there's something not going well in the company, how people react to it and how they behave is 80% of everyone else's experience, I think.
I agree. So you if you assuming you get the next round of funding, what's the future for Sighted Health?
The future is transatlantic for us. So we have been building our US team over the last year and are doing quite some exciting and interesting things in the US market now, which is a pretty important market for what we do. Yeah, as I mentioned, the future is transatlantic. So we're now evolving into a business that's active in more than one market and also one that is split across many time zones. I think we are on we have proven that our technology works. We have proven that there's clinical adoption for it. We have proven that it fundamentally can change clinical outcomes and patient outcomes. And the next big thing, and probably one of the, I would almost say, on the list of things that as a venture capital funded business, you want to prove that out is this the next thing we're proving is this as scalable as we think in the US market within our strategy that we've chosen? And, we are working on first few commercial, pilots right now. And there's a lot of other things going in the US market that in 18, 24 months, we will be in a position where we have answered a lot of these questions and we will get those first few signals. We are getting those first few signals on whether we're doing the right or the wrong thing now already, because we obviously want to have the time to adjust if we feel like there is something. But it's almost interesting because I haven't been asked this question actually in a while in this context. But the good thing is it has really reduced itself to people like our product. Here in the UK, we have a broad user base that has adopted the technology. It works clinically, it changes patient outcomes. So now one of the main things that we want to prove is it as scalable as we think it can be? And if we can prove that, I think a lot of the heavy lifting, at least in big phase one of what this business was set out to achieve, was achieved. So, and then after that, there's different trajectories. For us, always the question is, we have obviously raised venture capital, and there's an element of where do we want to take the business. It's to say completely self-sufficient company that finance itself of the revenue it makes. Are we going to sell it to a strategic in our space, which is, as you know, a lot of companies in our space end up going down that route. I think IPO is not really a particularly relevant topic at this time as another option. But yeah, we're not. I don't think we're that. Not as a matter of fact, I know that we're not far enough away of some of these conversations now, because we have these conversations. Like even over the last year, we had strategic conversations on being very interested in what our plans are, mostly because we have de-risked this technology to a certain point that we almost have line of sight of where there's a good opportunity of a bigger organization coming in and saying, we have a commercial engine and we can scale this up. Thanks for bringing it to this point. But yeah, I think that's sort of a few of the different angles on what's really, where our focus is really at currently and what we're driving towards.
Well, I hope it grows, and I hope that you'll be able to carry on your phone calls if it does. Yeah.
Yes.
Now, just before we finish, I actually meant to ask you before. Normally, I would give a choice. You can answer either of them. What are your hopes for the future of science, or what is one thing that you would change? I don't know which one you want to answer, or both. Or maybe in the context of sight health, or in a broader context, global health.
Yeah, I think one thing I really hope is that I have spent a lot of time with PhD students and other graduate and other grad students in the last few years that want to be more entrepreneurial, but they do not have the immediate opportunity in front of them. And I feel like there's there's a lot of activities, by universities and other institutions going on to try to break down that barrier. But there is something that we can learn from other countries and other ecosystems that are able to level this up significantly, or they are significantly better at not creating this perceived barrier of that there's some kind of magic ingredient towards taking the science you've been working on and really having impact in the real world with it. Because so many times, when I hear about someone who does work on some really interesting science and has some really interesting research going on, where there is a clear path for some real world impact. In many cases, the reason why they might not pursue that is not because they don't want, it's just because they don't know where to start. And my big hope is getting better at having big beacons which help people show where they can start and being able to facilitate that, because we do not want to have generations of academics that leave academia because they got disenfranchised with how it works and the boundaries and the constraints it brings with. You want to have people that can fluidly transition between those worlds and don't see them as something where there's a big red line drawn in the middle.
That's interesting, because the reason I say it's interesting is because not everyone sees, like you use the word perceived barrier, that perception. It's quite hard to overcome the concept of an individual perception. It
Absolutely.
almost has to come from that individual. They have to overcome it themselves.
Yeah, that's true. I think that is true. And you make a very, very valid point there. I think one of the things that here in Cambridge they have like the enterprise at the Dutch Business School, they have a number of different programs that can help interested PhD students to sort of like dip their toes into this world and all of that. And it's one thing of being shown, here there's a case study you can work on and this is how it would look like, and here you can exercise the process. It's another thing of being able to give someone the tool to see where your own journey and where you are right now can get you into this environment. It's a bit like the difference on, people that do MBAs. Well, there are very good reasons why you would do MBAs, but you're not going to start a unicorn just because you did an MBA. You learn a certain you learn a certain tool set, and you're going to expose to a certain environment, which will facilitate that journey if you decide to go on it. But it doesn't help you as much to see where my own situation or where your own situation, and particularly if you're in a slightly more insular environment in academia, certain deep tech areas, they are very insular research areas, how you can make that leap forward. Your point is absolutely correct, actually. There is a lot of individual responsibility in there. But I think I have gone through the system at different universities, and I feel like I'm someone, well, it's a bit of survivor's bias in this case. I'm now in the situation, so it's for me it has worked. But I do know other people where probably with very minimal level of nudging, it could have also worked for them at the time where they wanted it to work, and instead they left academia, for example, because they felt like, I missed certain momentum here that could have gotten me into a place that is really where I want to work because I love the science. And they, went into a job outside of academia because they had to, one or the other way, but not necessarily because they wanted to. So yes, individual agency plays a big role, but I think the institutional responsibility on shaping those opportunities and entry points is equally as important. And some universities and some ecosystems are better than others, but I think we're not going to be very successful, in terms of taking good science into or translating that into impact if that is concentrated to well-resourced institutions. Some of it is also how we deal with, academic research and breaking down barriers of technology transfer even further. It's some people will take this as an open secret, but technology transfer is getting better, but it's still miles away from, where it needs to be in order to make it easy for professors, grad students, other people alike, take their research and figure out what it can do in the world.
It'll be yeah, no harm in seeing where that line is, because perhaps there's a sweet spot and we haven't found it yet.
Correct. Yeah, yeah. And maybe we just have to try. I think that's
In the spirit of experimentation, why not?
in the spirit of experimentation. We have to try.
Well, thank you so much, Marcel. It's been really, really interesting talking to you. I'll look forward to seeing which direction Cited ends up going in.
Thank you, Harry. Thanks for having me.
Did you enjoy that episode of Lab Matters? If you did, please do send it to the people that you think will enjoy it the most.